Do you experience frequent heartburn or pain across your stomach area and your doctor prescribed you Nexium, also called Esomeprazole? Then this video is meant for you. We will cover how and when to take it, what are possible side effects and what are the correct dosages and much more. So make sure to watch the whole video so you don't miss any important information. For those of you that are meeting me for the first time, my name is Raoul. I'm a medical doctor from the Netherlands and I'm making weekly medical videos to educate my viewers. This video also comes with a quick disclaimer. It's meant purely informative. This is not medical advice, and when looking for medical advice, always contact your own doctor. And now, let's get started. As mentioned, the generic name of this medication is Esomeprazole, but it's sold under several brand names like Nexium, Strontium, and is available as capsules, tablets, injections, or oral suspension. Which brings us to how to use it. If you want to use it as a capsule, make sure to swallow it whole with half a glass of water. And if you do experience any difficulties with swallowing the tablets, you could also open them and put the granules inside of the capsule in a half glass of water, stir it and drink the water. The same is true for tablets. They consist out of small granules with a protective layer. Therefore, take the tablet with half a glass of water or let the tablet dissolve in a glass of water and drink it afterwards. However, do not chew on it. And again, the same is true when taking it as an oral suspension. Open the sachet and put the granules inside in half a glass of water, stir it and drink the glass of water. Do not chew on the granules. Lastly, if you want to take it as an injection, your doctor or your nurse will place the injection. You usually do not need to do this yourself. In addition, it's also important to mention that you can take esomeprazole at any time of the day, but it is recommended to do so at a fixed time. This will make you less likely to forget a dose. Now, esomeprazole is part of a group of drugs called proton pump inhibitors, and they selectively inhibit the production of stomach acid, and therefore it can be used to treat several medical conditions like heartburn, also called gastroesophageal reflux disease, an inflammation of your gullet or esophagus, an ulcer of your stomach or intestines, or an infection with H. pylori bacteria. Which brings us to the correct dosages to use. And here it is important to mention that you always need to use the prescribed amount and frequency of your doctor. I can only provide you with some guidelines, as your specific dose might depend on your indication of use, the severity of your symptoms and the side effects you might experience. However, when treating GERD or heartburn, your doctor might prescribe a dose of 20 to 40 milligrams once a day for 4 to 8 weeks. For the treatment of an ulcer in your stomach or your intestines, your doctor might prescribe a dose of 20 milligrams once per day for 4 to 8 weeks. And when treating an H. pylori infection, your doctor might prescribe you 20 milligrams once per day for 7 days in combination with several antibiotics. Now, esomeprazole is a very effective drug, but unfortunately it also can have some side effects. I will discuss the most common ones in this video, but if you're looking for a complete list, ask your doctor, ask your pharmacist or check your leaflet. Commonly, so 1 to 10% of all patients using it might experience a headache, nausea, vomiting, diarrhea, constipation or flatulence. Uncommonly, it might cause edema, sleeping disorders, hip, wrist or spine fractures, vertigo, a rash or a dry mouth. Rarely it can cause changes in several blood values, hypersensitivity reactions, agitation, a depression or taste disorders. Very rarely, it can cause multiple severe side effects. Which brings us to the safety of use. First of all, esomeprazole can cause dizziness and a blurry vision, especially the first few days or the first few weeks of using it. If you do experience any of these, then please do not drive, as this can be dangerous. Secondly, when you combine esomeprazole with alcohol, this can increase its side effects. Therefore, always be careful when doing so. And lastly, it can cause interactions with other drugs you're taking. Therefore, always discuss this with your personal doctor. It's also important to mention that the usage of esomeprazole when pregnant or when breastfeeding seems to be safe. Although there can be some exceptions, always discuss these with your personal doctor. Now, I hope you now know how and when to use esomeprazole, but if you have any questions, let me know in the comment section and I will do my best to answer each and every one of them. If you did like the video, if you did learn something, please leave a like. This will help out the channel tremendously, and consider subscribing. Posting weekly medical videos, and by subscribing you help out my channel, help me to reach my goal of 100,000 subscribers, and in return I will provide you with awesome medical videos. For those of you that can't get enough, I also have an Instagram account @howtomedicate, and I want to give a special thanks to my Patreon supporters. Thank you Sebastian, who's an Investor T supporter, once more, thanks, and I will see you next week with a new video. Bye bye.